Hydrotherapy. It's true that a shower can help calm down your anxiety, but doctors in the past really thought that it was the ultimate cure to just about any mental illness. Let's say you were a person diagnosed with bipolar disorder, or as it was known back then, manic depression. You go to see your doctor, and they recommend hydrotherapy. Now, if you were having a manic episode, they'd suggest a cold douche, and no, it's not what it sounds like. It was basically a power shower designed to cool down the heat of madness you were experiencing with cold water. This experience pretty much felt like standing under a waterfall during a freezing winter. That's the kind of cold we're talking about. On the other hand, if you were in a depressive phase, then maybe a douche or bath, or blanium as they called it, would be your best option. This wasn't a relaxing time in the bathtub, though. No, this was a bath so hot it could turn lobsters red. While the idea that a mental disorder could just be washed away is pretty ridiculous when you think about it, it's also kinda unfortunate, because life would be a lot simpler if that was true. Animal magnetism, mesmerism. In the 18th century, German doctor Frank Mesmer had a wild theory that every living being has a magnetic fluid coursing through them, and if there were any blockages in the flow of this fluid, then the person would become sick, both physically and mentally. So, if you had a psychiatric disorder, Mesmer would put on quite the show to get your magnetism back on track. He would sit in front of you, staring deep into your eyes while his hand gently moved from your shoulders down your arms. Or maybe he'd circle around you, slowly waving a metal wand as if he were conducting an orchestra, all to manipulate that magnetic fluid inside you. Mesmer had hundreds of patients, and while many of them believed that he cured their illnesses, we know now that this was just a result of the power of suggestion. Mesmer would literally mesmerize his patients by doing all kinds of strange, elaborate movements with his hands to put them in some sort of a trance, tricking them into thinking something amazing was happening to them when, in fact, it was all just a cheap magic trick. It's also worth noting that Mesmer's influence was quite far-reaching. Many practitioners began to use mesmerism on their patients and for stage performances. One of those practitioners was Dr. John Eliotson, who performed mesmerism over 3,000 times as a form of anesthesia before performing invasive surgeries like amputations and cataract removals. So it was clearly a powerful tool when used correctly. So there's a silver lining here, as Mesmer's practices gave us a strong understanding of the power of suggestion and imagination, which are the basis of real psychiatric treatments today, such as the placebo effect and hypnotism. So in a way, we have Mesmer to thank for those things. Simulated near-death experiences. You know how when you have the hiccups, your friend might try to scare you so that they would shock you out of it? Well, this is kind of the same thing, just cranked up to 100. The idea of this treatment was that a doctor would cure your madness by putting you through an extremely shocking experience that would hopefully change your mental state, basically resetting your brain. So, if you were a paranoid schizophrenic, for example, you'd be submerged in water to the point of drowning, but just before you die, the doctor would pull you out of the water. Obviously, this is not how you treat a mental disorder. In fact, if you were a paranoid schizophrenic and went to a therapist for treatment, the last thing you'd want is for them to begin drowning you in water. Not only would this exacerbate your paranoia, but it would also add water to the list of things that absolutely terrify you. Restraint chairs. The idea of tying someone you think is dangerous or mentally unstable to a chair is pretty straightforward and has probably been around since chairs themselves were first invented. This is why in the 1800s, asylums began building chairs specifically designed to restrain psychiatric patients. These weren't just any old chairs, though. They were solid, robust, and built to last. Crafted from sturdy wood, they were designed to ensure the people restrained in them had no chance of escaping, no matter how hard they tried. To secure the patient, straps made of leather or fabric and sometimes even metal chains were attached to the chair. These straps could be fastened around the patient's wrists, ankles, and waist, making it nearly impossible for them to move at all. So you can imagine the torture these patients must have felt, especially since a lot of the time they were kept in isolation. Thankfully, as we moved into the 1900s, things began to change as psychiatrists finally realized that causing mental health patients more trauma trauma by strapping them to chairs for days wasn't really the best way to treat them. Fast forward to today, and while restraint chairs still exist, they've come a long way. They're designed to be more comfortable than they were in the past and are only used in extreme cases. Wandering womb. One of the most ridiculous treatments comes from ancient Greece. In this era, people had some pretty wild ideas about women's health. They thought that everything about a woman, her thoughts, feelings, behavior, and everything in between, was controlled by her womb. The womb was pretty much considered the puppet master, pulling the strings of the woman's entire existence. But what's even stranger is that they also believed the womb was a mobile organ able to move around inside a woman's body, causing all sorts of health problems. So, if a woman showed any signs of a mental disorder, the physicians would diagnose her with a condition they called the wandering womb. To put it bluntly, they thought the woman was acting crazy because her womb was running away from where it was supposed to be. Obviously, the most logical treatment here for the doctors was to do all they could to return it to where it belonged. One method was to use smells. They'd put nice smells near the woman's lower body and bad smells near her mouth, creating a scent trail for the wandering womb to follow back home. Another way was to make the woman sneeze, as they thought the force of a sneeze could shove it back into position. Sometimes doctors would even try to move the womb back into place by hand. They might massage the woman's belly or lower body, trying to push it back where it should be. Those were really strange times when treating a female patient's mental health somehow turned into a game of hide and seek with her womb. Madstone Therapy. We're lucky that we don't have to worry about animal attacks in our daily lives anymore, but in the past it was a real problem. Picture a dog not as man's best friend, but as a dangerous creature whose bite could cause not just physical injury, but also spread a deadly disease like rabies. In those times, if people saw you showing the terrifying symptoms of rabies like drooling, muscle spasms, and aggressive behavior, they would think you were losing your mind. Some of them would probably even think you were turning into a werewolf, if we're being honest. Without the modern medicines we have today, folks had to rely on folklore remedies. One such remedy was the Madstone, a special concoction believed to prevent rabies and treat animal bites. The Madstone is a hard object that's sometimes found in the stomach of a grazing animal like a deer when a piece of food that didn't get properly digested begins to harden. It's kind of like finding a pearl in an oyster, but less glamorous and more digestive. The Madstone was seen as a magical cure for rabies. People would press it into the bite wound on their body, thinking it would draw the poison out. Some even boiled the Madstone in milk before applying it to the wound. The belief was that if the animal that bit you did in fact have rabies, the Madstone would stick to the wound, drawing out the poison. Once the Madstone was full, it would fall off, only to be rinsed in milk and reapplied until it no longer stuck, which would mean there was no more poison inside you and you were cured. And that's how people thought they could cure rabies back then. So let's take a moment to be grateful that we've moved on from Madstones to vaccines. Lobotomy. A lobotomy is a medical procedure where connections in the prefrontal cortex are destroyed. The problem is that the prefrontal cortex is a crucial part of the brain. You can think of it as a control center of the brain. It helps us make choices, control your actions, and understand the world around us. So you can imagine why destroying connections in it can lead to some terrible results. Today, lobotomy is widely considered a dark chapter in medical history, but it's also quite ironic. The entire point was to treat a mental disorder by destroying these connections in the brain. But after the surgery, patients often ended up with a host of awful side effects like dementia, epilepsy, permanent brain damage, and even changes in social behavior. They could become impulsive, rude, and unable to show the appropriate emotions. With all that in mind, it's safe to say that lobotomy was a classic case of the cure being way worse than the disease. The early days of lobotomy were even more brutal. Surgeons would drill holes in a patient's head and inject ethanol to destroy the nerve connections. But as the procedure evolved, the surgeon would typically use an instrument called a leucotome that looked a lot like an ice pick to access the brain through the eye socket. The surgeon would then simply wiggle the ice pick around to destroy the nerve connections. The whole notion of with a surgeon's precision was really thrown out the window here. And here's the kicker. Despite all its flaws, the lobotomy was actually once celebrated as a groundbreaking innovation. In fact, the doctor who first introduced it, Antonio Egas Moniz, even won the Nobel Prize in Physiology or Medicine in 1949 for his work. From the very start, it was clear that lobotomy is an inhumane and unethical procedure to perform on anyone. Yet surgeons continued to perform it for around 2 decades on over 50,000 people. Opium therapy. Opium, along with its derivatives such as morphine and heroin, has been used in medicine for ages. This substance, found in the heart of the poppy plant, was once considered a wonder drug because of its powerful sedative effects. Basically, if you felt any kind of pain, opium would make it go away in no time. As far back as 400 BC, physicians in Greece were prescribing opium for a whole range of illnesses, including sleep disorders and other health problems. Fast forward to the aftermath of the American Civil War, and veterans dealing with both physical and mental trauma found comfort in the numbing effects of opium. It was so prevalent among veterans that it was dubbed the soldier's disease. However, this comfort came with a heavy cost, as by 1895, an alarming 1 in 200 Americans was suffering from an opioid addiction. Today, due to the highly addictive nature of opium and its derivatives, these substances are strictly regulated. Our focus has shifted from using opium for treatment to helping those who are struggling with addiction to it. Charcot's demonstration. Jean-Martin Charcot was a renowned French neurologist known for his enlightening and dramatic public demonstrations. These weren't your average medical lectures. No, they were actually stage performances starring Charcot, his assistants who were skilled hypnotists, and his patients who suffered from a variety of disorders, most often what was referred to at the time as hysteria. After Charcot's assistants had hypnotized the patients, Charcot was able to control the symptoms of hysteria, either bringing them on or making them disappear. This was his way of proving that mental disorders weren't necessarily tied to abnormalities in the brain or other organs, unlike other neurological disorders. Instead, they were strictly psychological. This groundbreaking work sent ripples through the field of mental health and significantly influenced the emerging disciplines of neurology and psychology. And it didn't stop there, as it even influenced the work of none other than Sigmund Freud, who would of course go on to become a pioneer of psychology. It's true that Charcot's demonstrations may have been overtly theatrical, some even referred to it as a circus, and he's definitely manipulated his vulnerable patients by exploiting their disorders. But at the same time, these shows did give us real medical insight and actually helped change our understanding of the human mind forever. Rotational therapy, spinning treatment. In the 19th century, a unique method to treat mental health problems was developed by English physician Joseph Mason Cox. Known as rotational therapy, this method was primarily used to assist patients dealing with mania or other heightened states of arousal. The essence of this treatment involved a specifically designed chair, often referred to as Cox's chair. Patients were placed in this chair and spun around at high speeds until they lost consciousness. This strange treatment stemmed from Cox's belief that spinning patients around very quickly could alleviate their mania by increasing pressure, thereby reducing what he termed brain congestion, which obviously is not a real thing. But let's be clear, this method isn't actually effective as a treatment for any mental disorder at all. And if any patient undergoing a manic episode did calm down after rotational therapy, it was probably because they were really dizzy and the whole world around them was just a big blur. The gyrator. It's always fascinating when you take a look at the history of any profession and realize how strange things were in the past. In this instance, we're taking a look at Dr. Benjamin Rush, who's often considered the founding father of American psychiatry, and boy, did he have some unique ideas. One of them was his invention called the gyrator, which was designed as a beacon of hope for people struggling with depression or lack of motivation. Say you were suffering from a disorder like depression. Then Dr. Rush would securely strap you onto the gyrator, which was basically a horizontal board hanging down from the ceiling, allowing it to rotate freely. He'd then turn it on, causing you to spin around over and over for a duration determined by your condition. It was pretty much a more extreme version of a merry-go-round. Now, this obviously sounds bizarre by today's standards, but back then it was seen as a powerful tool for managing a patient's condition. It was a key part part of Dr. Rush's holistic approach to psychiatric care, which included some pretty out-of-the-box recreational activities for treatment. The gyrator isn't used anymore, but it's important to remember that Dr. Rush never tried to make it seem like a miracle treatment or anything like that. It's just that he genuinely believed in its effectiveness and would always conduct a thorough assessment before deciding if the gyrator was the right treatment for you. Safe to say, it was never actually the right treatment for anyone. Thanks for wasting my time, Doc.